Attorney General Merrick Garland has made it clear in recent speeches that the Department of Justice is coming for white-collar crime. Organizations that have had prior ethics and fraud convictions will be at the top of their list to re-examine. In fact, recently, criminal charges were filed against 36 defendants in 13 federal districts across the United States for more than $1.2 billion in alleged fraudulent telemedicine, cardiovascular and cancer genetic testing, and durable medical equipment schemes. Additionally, the Centers for Medicare and Medicaid Services, the Center for Program Integrity, announced recently that it took administrative actions against 52 providers involved in similar schemes. Quote from the Department of Justice: "The Department of Justice is committed to prosecuting people who abuse our health care system." And here's the problem. It's all too easy to continue doing what's been done in the past, saying, well, everybody does it, assuming that this is a defense. If there's one thing that's clear, the current administration is tired of lax application of well-known rules, and they're actively looking. So the question most healthcare providers need to ask is, what are we doing to shore up our employees' behavior so that we don't fall victim to the active approach the Justice Department is taking? So let me pose this question to you. What makes smart, well-educated, well-intentioned people make unethical choices? Hi, I'm Chuck Gallagher, and I know firsthand how that happens. Over 30 years ago, I had a lapse in judgment, making an unethical, well, actually illegal choice to solve a problem which seemed very rational at the time. The outcome? It landed me in federal prison. Now, while I am not proud of my past choices, the headlines are filled with people, especially lately in the medical profession, who have been caught behaving unethically. The consequences for those bad actors? Well, prison. The consequences for their organizations are disastrous and long-lasting. And the government is now actively looking. You see, for the past 25 years, I've focused attention on two primary questions. What motivates people to make unethical choices? And what can we do to recognize and prevent those poor choices? Having been blessed to speak to healthcare and medical device companies worldwide, what most organizations say is that my programs are eye-opening and present ethics in a new light that connects with people and helps move the needle toward more ethical behavior. Let's be clear. There has never been greater legal focus on the ethics crisis facing the medical profession. Why? What has changed over the past decades that created the environment for such amazingly poor behavior? What real pressures are people facing that make them feel backed into a corner? Let's be honest, the pressures will not get easier. So whether a presentation at your annual meeting, live or hybrid training sessions, or through our weekly video teasers, let's talk about how we can work together to raise ethical awareness with your organization and for your people.